Should pharmacists be allowed to deny prescription on ground of conscience? No. What is emergency contraception? EC. EC, also called the morning after pill or Plan B, as many people know it today, is a birth control that prevents pregnancy after having unprotected sex. EC usually comes in the form of a pill. It is most effective if taken right after unprotected sex, but it can work up to 5 days of occurrence. The pill works by releasing a large amount of hormones, which are estrogen and progesterone, into a woman's body. These levels of hormones interfere with the woman's ovaries so that it stops the ovaries from releasing an egg. High levels of estrogen and progesterone also makes the womb's wall slippery enough so that if an egg is released and gets fertilized, it won't be able to stick to the womb's wall, where the development of the fertilized eggs will normally continue. History of emergency contraceptive pill. This method of contraceptive has been around for years. While it has never been used on humans, people use it on animals with high success rates. The earliest human trials known have dated back to the 1940s but were never documented. The earliest documented human trials dates to the 1960s in the Netherlands where physicians applied this method on a 13-year-old girl who was a victim of a rape. This soon led researchers to standardize this method of contraception for women in the US and Canada. The first of these methods was called USP method, named after the physician who pointed out the exact dose needed to induce endometrial changes that are incompatible with implantation. Introduction of RU46. RU46 is not like EC pills. They are completely different and should not be confused with one another. RU486 is considered an abortion pill because unlike EC that needs to be taken almost immediately after unprotected sex to be effective, RU486 can be taken up to 9 weeks after unprotected sex. If the woman got pregnant, by now the unborn baby will have a beating heart. With the introduction of RU486 into the market as early as the 1980s, complicated the relationship with physician, pharmacists, and the women that need emergency contraceptive pills. Moral complications. Many pharmacists denied women requests for EC prescription because of their conscience and moral beliefs were challenged. For all they know, EC pills are the same as RU486. Scientifically, this assumption is incorrect, and because of the lack of knowledge, pharmacists have denied many prescriptions leading up to women having unwanted pregnancy. This has led to many rape victims having babies of the perpetrators. Should pharmacists be allowed to deny prescription on grounds of conscience? No. Like many other professions, pharmacists are protected by law when they deny practice on a patient when their religious, moral, and conscious beliefs are challenged. But like any other profession, pharmacists have fiduciary duty to assist the public with their medications. Even though the law protects their decisions to deny practice based on their religious or moral view, the well-being of the patient outweighs their decision not to practice if the outcome for denial to practice is detrimental to the patient. Pharmacists have argued that denying to fill prescription for EC is not detrimental to the patient. In their perspective, they are saving a life, thus justifying their decision not to fill the patient's prescription for them. I believe that even though they might see EC pills as immoral, they can't force their beliefs on their patient. If they don't want to fill out the prescription, they have fiduciary duty to that patient and should refer the patient to a pharmacist who has no problem filling out the prescription for them. This might seem like a simple solution to the problem at first glance, but pharmacists have argued that even giving a referral is a way of passively being involved in the process, again challenging their moral or religious beliefs. Some even deny referral based on this argument. This might not be a problem for someone who lives in the city that has access to dozens of different pharmacists, but it is for someone who lives in a remote place in the United States who might not have access to someone else. Should pharmacists be allowed to deny prescription on grounds of conscience? No. As a pharmacist, they have an obligation to society. No one forced a pharmacist to become a pharmacist. The role of a pharmacist has a social contract with the community they serve, which is to help those around them. Their duty to the community is to dispense the drugs they are prescribed and help those around them become more informed on the drugs they are consuming. The role of a pharmacist have a professional standard they must adhere in the United States. These standards are clearly stated in the American Pharmacists Association Code of Ethics. These ethical codes can be viewed as Socrates' virtues, as someone ought to be. If someone wants to be a pharmacist, these code of ethics from American Pharmacists Association is how a pharmacist ought to be. Denying to fill, even refer a patient to get their prescription for EC or RU486 might not be breaking the law, but it is unethical and unprofessional act in their field. We live in a democratic society where everyone has the right to live their life the way that they want to. That is why government has created laws to protect pharmacists if they deny practice because they believe it is morally wrong. This does not give them the right to decide how someone else has to live their lives. The same rights the pharmacist has under the law is the same for the patient, which is liberty. Today, fortunately, the FDA in 2006 approved EC to be purchased over the counter. This means anyone can purchase EC without a prescription. With the approval of EC over the counter, women around the United States have taken back control with what happens in their life. Besides, having a baby is a life-changing event. It is not right that the decision to have a baby is in the hands of a few physicians or a pharmacist, and not in the hand of the person who is most affected by the situation.